plain seated piriformis stretch, keep both your feet on the floor to begin with. Then on the affected side, you're going to cross that leg over like so. Keep the heel on top of the opposite knee. You're going to lift the bottom heel, which is on the floor, upwards towards the ceiling. Keep the toes on the floor though, so lift the heel upwards. If you're experiencing back pain, keep your back straight and then lean forwards. So all I've done, lifted my heel up off the floor, kept my back straight and leant forwards. And then you're going to feel a good stretch sort of on the bottom of the affected glute and piriformis, and should help alleviate the symptoms. If you're feeling the symptoms aggravate, then you can cut this exercise out and pick it up later on in the day. Or if you're feeling the benefit, you can repeat it for a 20-second hold 3 times, first in the morning and lasting in the evening as well, or whenever you like it. You can also do this lying on your back. So you're just going to lay on your back in bed or wherever. Same again, just do what you did whilst you were seated on your back. So you're going to cross the affected leg on top of the knee of the opposite leg, push the bottom leg up towards you, so towards your head, and then you'll feel it all stretch on this bottom of the left side, which is the affected side, for myself, for example. Okay. The next one you can do is a sitting stretch in a similar position if it's a little bit easier. So again, one for you to try. All I'm going to do is cross the affected leg again as if I was crossing my legs over, just like so. The opposite leg I'm just going to hold behind me. So I don't know if you can see that, but this leg is crossed as if I was sitting down with the first exercise, and this the second side, the opposite leg is just behind me, sort of off to the side as well, bending at the knee. And you're just going to hold this position again for the same time and see if it helps you. Another one you can do is a clamshell, but this one lying on your back if it's easier. So keep your feet and your ankles together, but keep your knees apart. Then all you're going to do on the affected side, which is my left side for example, I'm just going to bring the leg out, and that's going to open up the clamshell and close it again. Open up the clamshell, close it again. And it just helps floss the piriformis muscle. A lot of the time when the piriformis muscle is quite tight and restricted, your hip joint will also be affected. So you want to make sure that that hip joint, which is a ball and socket joint, is being, but essentially, that there's good motion in there. So what you can do, stand, holding your hand against the wall or wherever you are in the queue, and you're just going to do some hip circles just to floss out both sides, both of the hip joints if you like to, but make sure you do the affected side a lot as well. And that's just going to help keep things open. It will also help stretch the muscles slightly, but not as much as the previous exercises. The next one you can do is a bird dog position. So you'll be in a dog position, and then you're just going to take your affected side, and you're just going to kick the leg out to the side, back in, out to the side, back in. If you want to, you can make sure that your back is quite straight. It's up to you if you prefer it this way. If you feel that it's easier just to give a slight bend into the back, then that's fine as well. But essentially, you're just going to take the leg, kick out to the side, back in again, kick out to the side, back in again. You can also do it straight behind you, so straighten the leg, back again, straighten the leg, back again. And see which one of those works for you. One that you can do is a lay on your front stretch. So you're just going to lie like so, take the affected leg and bend it at the hip and the knee, and just hold it slightly off the edge of the bed or off the bench, wherever you're on. And you're just going to lay there with your knee bent, with your foot touching your opposite leg if you want to, just to create some stability. And you're just going to hold it in this position and see if it helps alleviate any of the pain. A lot of the times I find that my clients get a lot of relief in this position, especially if they're suffering from an acute, really severe episode of piriformis syndrome. Especially when you're sleeping, if you're finding it difficult to sleep with piriformis syndrome, you're just going to lay on your side, keep the affected leg either up or at the bottom, either way, and then you're going to pop a pillow just in between your knees, just to prevent your leg from dipping forward. When it dips forward, when it drops down, it starts to pull in certain areas, which will aggravate your symptoms. If it helps in this position, keep it this way. The other thing you can try is what I just said, with a pillow in between your knees. Try and keep it there throughout the entire night. A good little trick that I like to use, if you have a spare pillowcase, then you can cut a hole through the pillowcase and then thread your leg through the case. The pillow will obviously still be there, but the hole will be just big enough to thread your little foot and your calf muscle through, and then that way you can't really kick it away at night, which a lot of people obviously will do whilst they're in bed. If you've just got a butter knife at home, for example, get some lotion, put it on the butter knife, make sure you use the soft edge, not the sharp edge of course. Use the soft edge. What you can do, just gently onto the skin, so I'm not going to show you my skin obviously, but just gently onto the skin, take the butter knife and do a gentle massage on the areas that it hurts. Quite gentle, don't go pressing in, don't make it go red or pink, just a gentle massage just to help you feel that there's some alleviation of symptoms. If you don't get any alleviation of symptoms with any of these exercises, then cut it out, give yourself a little break, try some of them again. If they help, keep doing them.